You're watching CTOM TV. Knowledge is power.
So now we're going to get into immunotherapy very briefly,
Okay.
because if you look at the numbers of the immunotherapy trials, you'll see we're getting into the hundreds for the different drugs.
Wow.
So
100 different types of immunotherapy.
No, I will explain that in a minute.
Okay. Hundreds of clinical trials.
Yes.
Okay.
Hundreds of clinical trials, yes. So immunotherapy, what we know, indicators for response to immunotherapy, and we always look at prognostic features and indicators of response.
Okay.
One of the things that seems to really be an effective guide for immunotherapy in lung cancer, and this seems to apply to all types of lung cancers, is high PD-1 expression. So if you have over 50%, you're going to have a great response to immunotherapy.
Oh.
Even 1 to 49%, you're going to have a good response. Now, the problem is PD-1 is often determined using biopsies. Not a good way to do it, because there's a lot of discordance between biopsies.
Right.
So we recommend that you look, if you're going to do PD-1 testing and you're not going to look at the blood and do a liquid biopsy, then you need to look at 4 separate biopsies. Because there's going to be a lot of variation between those. So
Right.
one biopsy may have low PD-1, and all of a sudden your doctor's saying, well, you got low PD-1, we're not going to give you immunotherapy.
Right.
And then another one may have high PD-1. So you have to look at least 4 different
Okay.
biopsies.
But most people don't have 4 biopsies.
No, I know, and that's
No.
a bit of a problem.
In which case, because immunotherapy can be so incredibly beneficial, if you have PD-1, you want to definitely have a blood-based test for that.
Yeah.
Then.
And a tissue-based too as well.
Okay.
You want to look at it from different angles.
All right.
So another thing that determines whether these immunotherapy works well in lung cancer patients is your MSI status, your MMR. And we discussed that in last week's immunotherapy. So MSI is microsatellite instability, and MMR is mismatched repair. Interesting enough, being an ex-smoker is a good prognostic feature for immunotherapy. And that's probably because all of the different mutations that smoking causes really make the cells stand out to the immune system. So, smoking has a lot of carcinogens. And so it really damages the DNA in your cells. And so that's going to be much easier to recognize by the
So
immune
when you
system.
boost the immune system with immunotherapy, it's going to find those.
And it's going to have an easier time of recognizing and discerning what's a cancer cell and what's not.
It's not a good reason to start smoking.
No. Now, interestingly enough, tumor mutation burden, in other words, the amount of mutations, at this time, we originally thought it was going to be a great tool for every cancer. But for some reason, lung cancer is not the best indicator.
Not a good indicator.
No. And that's probably because in the study that looked at tumor mutation burden, there's a lot of variation in how they determined tumor mutation burden. And then they didn't necessarily stratify for these specific mutations. So whether it is or not a factor, we don't know yet. The data is saying no. And obviously we have to go with data, but you have to stratify too. You have to look at the different mutations.
So MSI and MMR are good indicators for this type of cancer, but not the tumor mutation.
Yeah, so those are a type of, MMR is mismatch repair. So it's a type of gene involved in DNA repair.
Thank you for watching CTOM TV. Subscribe below and stay informed.